Hello friends, so today's topic is lymphatic drainage of the breast mammary gland. So let's start. Lymphatic drainage of breast, it is of two types. First is lymph nodes and the second is lymphatic drainage. Carcinoma of breast spreads mostly through lymphatics. So let's start with the first one, lymph nodes draining the breast. In that we have 5. First is axillary lymph nodes, which lies in axilla, and it is divided into 5 groups: anterior, that is also known as pectoral, posterior, central, lateral and apical. Then we have the second, that is internal mammary nodes, which lies along internal thoracic vessels. Third is supraclavicular nodes lying along internal thoracic vessels. Fourth is posterior intercostal nodes lying in posterior intercostal space in front of head of ribs. Fifth is cephalic deltopectoral nodes lying in deltopectoral groove. Then we have lymphatic draining the breast. First is superficial and the second is deep. So let's start with superficial. Superficial lymphatics drain the skin of breast except the nipple and areola region. Deep lymphatics drain the parenchyma of breast, skin of nipple and areola. Note point is, plexus of lymph vessels deep to areola is called subareolar plexus of Sappi. This is an MCQ question. Then we have lymphatic drainage from breast occurs as follows: lymphs from lateral quadrant, medial quadrant, lower lateral quadrant, lower medial quadrant. Okay, so let's start with lateral quadrant. Drained into anterior axillary, also known as pectoral group of lymph nodes. Its location is situated deep to lower border of pectoralis minor. Then second one is medial quadrant. Drained into internal mammary parasternal lymph nodes. Location situated along internal mammary artery. Some may go to opposite side to the internal mammary artery. Then third we have lower lateral quadrant. Follows posterior intercostal artery and drain into posterior intercostal nodes. Location along the course of this arteries. Then the fourth one we have lower medial quadrant. It crosses the costal margin, pierces the linea alba, and it communicates with subdiaphragmatic lymph plexus and subperitoneal lymph plexus. Then the fifth one is deep surface of breast. It pierces pectoralis major and clavipectoral fascia. Second is drain into apical group of axillary lymph nodes. Okay. Now let's understand its diagram. The diagram in which the lymph nodes are shown, that is an important diagram. So first, up of the clavicle, there is a supraclavicular nodes. Okay? Then the second one is deltopectoral node in the upper arm section. Then we have internal mammary nodes in between the, in the midline area. Then we have posterior intercostal nodes in the lower side of the breast, in the between the axilla and the breast. Then we have the axillary lymph nodes. There are 5 axillary lymph nodes: apical group in the below the clavicle, then central group and lateral group in the arm, and the anterior and posterior group. The anterior group is above the breast and the posterior group is below the breast. I hope you understood the lymphatic drainage system of the breast. It's a very important question. It can come in 5 marks or 10 marks or a part of a question. And if you have any doubt, you can drop it in the comment section. I'll definitely respond. Thank you. Take care.